Hi, I'm Dr. Amy Myers. I'm a medical doctor, functional medicine physician, and two-time New York Times best-selling author and the founder and CEO of AmyMyersMD.com. I've founded AmyMyersMD.com with a vision of helping others, a vision of enabling people to recover from chronic illnesses, a vision of creating a clear path to optimal health and wellness. Something that was better than what we all know through conventional medicine and prescription drugs. I'd like to share with you the experiences that impacted my life and led me to this vision. It began in 1996, during the time I was a Peace Corps volunteer in rural Paraguay. A little boy, covered with pustules and with a fever of 105, lay on a mattress on a dirt floor, breathing shallowly. His name was Louis. No one seemed to care about how sick he was. After hours of searching for help, I finally managed to get him to the hospital, 2 hours away by tractor, for the treatment that saved his life. Later, I realized that it was not that no one cared, it was just that the death of a sick child was a normal part of life for the people of rural Paraguay. I knew there had to be a better way. I would become a doctor. In 1999, my mother, Betty, was having severe back pain. She went to her doctor several times. However, he didn't order many labs or tests because my mother didn't have health insurance. Eventually, my mother was diagnosed with metastatic pancreatic cancer. 4 months after she was diagnosed, I held my mother's hand as she took her last breath. My mother, much to my dismay, had followed her conventional doctor's advice and did chemotherapy. I am convinced to this day that that chemotherapy killed her much more quickly than if she had done nothing at all. I knew there had to be a better way. I would become a researcher. Instead of sitting at home wallowing in my sorrows after my mother's death, I did become a researcher. I studied noni juice and found it to be a natural angiogenesis inhibitor, and I was granted a U.S. patent for my research. During my second year of medical school, I started to experience weight loss, anxiety, and insomnia. I was eventually diagnosed with Graves' disease, an autoimmune condition of the thyroid. Conventional medicine solution was to ablate or kill my thyroid with radioactive iodine. It is the biggest regret of my life. I knew that there had to be a better way. I would prevent others from going through what I did. Conventional medicine failed me, and it is my mission to not have it fail you too. In 2005, I started my emergency medicine residency, and while on my ICU rotation, I met Jessica. Jessica was in her 20s, newly engaged, yet she had rheumatoid arthritis. And she was also in liver failure from an immunosuppressive drug called Remicade. If she didn't get a new liver soon, she was going to die. As the ICU doctor on duty, I cared for Jessica all night. I didn't sleep a wink. I was either checking on her labs, the transplant team, or updating and comforting her family. In the final hours, just before Jessica's liver failed, the transplant team received word that they had found a liver for her. Jessica was in the prime of her life. She never should have gotten to this point. No one should. I knew that there had to be a better way, and I was determined to find one. In 2009, I attended a conference in New York and heard about functional medicine for the very first time. Functional medicine seeks to find the root cause of illness rather than simply treating the symptoms with pills. Finally, I had found a better way. I immediately began learning through the Institute for Functional Medicine. I took every course that they had to offer. And a year later, in 2010, I left my position as an ER physician and I opened my very own functional medicine clinic, Austin Ultra Health. After working with thousands of patients, I developed the Myers Way, a dietary and lifestyle program which helps individuals to identify their unique root cause of their health condition and empowers them with the tools to reverse their illness, in order for them to live their solution. Patients came to Austin Ultra Health from all over the world to reverse their autoimmune, gut, and thyroid conditions. I'd like to share with you the stories of a few of those patients. One of my very first patients was Jennifer, and she was very complex. Jennifer was diagnosed with polymyositis, an autoimmune disease which affects the muscles. Jennifer was on 3 powerful prescription immunosuppressive drugs, and they were not working. At one point prior to seeing me, she'd been unable to walk and was using a wheelchair. After treating Jennifer for several months by changing her diet, healing her gut, and advising her to move out of her home that was infested with toxic mold, I was able to help get her off all of her prescription medications. Her labs returned to normal and she felt great. It's been many years now, and Jennifer remains symptom-free, medication-free, and more importantly, she's living an optimal and happy life with her husband and her daughters. By using the Myers Way, I was able to help give Jennifer her life back. Another patient, Susan, had been diagnosed with transverse myelitis, also an autoimmune disease that is very similar to multiple sclerosis. When Susan first came to see me, she told me that her goal was to get out of pain so that she could play with her grandchildren. Susan had been using this special cream that helped the pain, but she was only able to use it for a few days at a time because after a few days, her body would get immune to the cream and it would stop working for her. Without the cream, Susan could barely walk, eat, or sleep because she was in so much pain. I introduced Susan to the Myers Way. She changed her diet and her lifestyle. She gave up gluten, and we worked together to heal her gut. When I spoke with Susan on her 3rd appointment, she had called me from California where she was visiting her grandchildren. I asked how she was doing and if the cream was working. She paused and she said, "Oh my, I just realized I left it at home. I have no pain, so I completely forgot to bring the cream with me." To this day, Susan remains off her special cream, and by following the Myers Way, Susan was able to achieve her goal of being pain-free and to play with her grandchildren. And then there's James, my dad. He told me that I saved his life. He, like Jennifer, was diagnosed with polymyositis, and he was resistant to following the Myers Way. However, at 78 years old, he needed a hip replacement. In preparation for that surgery, his physicians needed to take him off his 3 powerful immunosuppressive drugs. They needed 30 days for the drugs to get out of his system. And knowing how powerful the Myers Way can be in as little as 30 days, I suggested one more time that my dad give it a try. And he did. After his surgeries, his doctors couldn't believe that his autoimmune markers were in the normal range and that he was still off all his immunosuppressive drugs. By continuing to follow the Myers Way, my father stayed off all of the drugs. His labs returned to normal and he was symptom-free for over 2 years. There is a better way, and it's the Myers Way. So how did we get here, and how did amymyersmd.com come to be? For a decade, I loved working with patients in my clinic. However, at Austin Ultra Health, I could only help one person at a time. I spent so much time with each patient. I could only see 4 patients a day and 3 new patients a week. That meant I was only able to help about 150 people a year. I was on a mission. I wanted to help way more people than that. So I began writing. I created a blog, and I was a guest writer for several larger blogs. One of my first guest articles went viral. People from all over the world were sharing what I had to say. I was helping more people, and my newsletter list grew to 20,000 subscribers. I kept writing, and in 2015, I published my very first book, The Autoimmune Solution, which became an instant New York Times bestseller. That same year, I launched amymyersmd.com. The Myers Way had become a way of life for hundreds of thousands of people around the world. I was helping to empower more people than I ever could have dreamed to take back their health. At the same time, Austin Ultra Health was growing. People were traveling from all over the world to see me. There were over 1,000 people on my waiting list waiting to become patients. In 2017, we launched our very first online program, the Autoimmune Solution Program, on amymyersmd.com. It was a huge hit. That same year, however, my father had an autoimmune flare, and he went back on the immunosuppressive drugs at the advice of his doctor. Shortly after going on the drugs, I got a call that my father was in the ICU with sepsis. His immune system was so suppressed from the drugs, he could not fight off the pneumonia, and he died. A month later, my husband and I flew to Wisconsin to welcome our adopted daughter, Elle, into the world. So much was happening all at one time. As a new mom, I knew I couldn't do it all and do it all well. I had to make a really difficult decision about what would need to give. I looked at the numbers. If I devoted my time to Austin Ultra Health, I could only help 150 people a year. And if I devoted my time to amymyersmd.com, I could possibly help millions of people. And that's what I wanted, to help more people like Lewis, my mom, Jessica, Jennifer, Susan, my dad, and me. So I chose to retire from clinical practice and focus on amymyersmd.com. Since its inception, only a few short years ago, amymyersmd.com has grown exponentially. We now have over 500,000 people in over 122 countries around the world who are receiving our newsletter each week. I've gone on to write 3 national bestsellers, and they have been translated into 10 different languages. amymyersmd.com's online programs and nutritional supplements have helped hundreds of thousands of people around the globe regain their health. amymyersmd.com is a trusted resource where individuals can go to get to the root of their illness while learning the tools to take back their health in order to live their solution. Amy Myers MD continues to grow because of the care, effort, and quality that my team and I put into every interaction, every product, and every piece of information that we share with the world. Everything that my team and I do stems from our core values. Serve. We go above and beyond to be of service. Effect. We actively look for a way to make a positive impact. Empower. We empower people and deliver quality results. Our mission is to empower people to take back their health by providing them with the tools to understand the root cause of their symptoms and to live their solution. Our vision is to inspire a healthier, more informed world where chronic illness is a thing of the past and our tools are used by millions around the world to achieve optimal health. This is the why of amymyersmd.com, and it's what drives everything we do.